Cognitive behavioral therapy, or CBT, is currently a much discussed therapy and is recommended for many mental health problems. This is an effective and one of the most researched treatments. Stay tuned to find out more about what CBT involves and how it can help. But before we get started, please subscribe to my mental health educational channel and hit the notification bell so you don't miss new content I release every Friday. So, what is CBT? Unlike some other therapies, which are aimed to explore your past, CBT is targeting the present and looks to the future. The main belief behind this therapy is the idea that our thoughts, feelings, and behavior interact with one another. If we change one of these, we can change all the others. CBT helps you in the first place to understand your thinking and behavior. Our thinking determines what we feel and what we do next. When you often interpret events in a negative way, it's more likely to lead to feelings such as fear, sadness, or annoyance. Despite widespread belief, not the events, but these feelings influence what we do or do not do. If it was true that events caused emotional responses or feelings, then everyone experiencing the same event would experience the same feeling, but they don't. Different people in same situation can feel very different and react very differently because they have different thoughts. For example, a man lies in bed at night and wakes up in the middle of the night because he heard a noise outside. He thinks it must be a burglar. He feels anxious and worries and calls 911. His neighbor also wakes up in the middle of the night because he heard a noise outside too. The neighbor thinks it must be the cat who knocked something over outside. The neighbor does not feel anxious or worried. He turns around and continues to sleep. With this example, I want to show that it's not so much the situation, but the interpretation of the situation that determines how we feel and behave. When we are upset, our reactions can feel overwhelming. It can be hard to figure out what is making us upset, and we often blame the situation. People's pattern of thinking is like wearing a pair of glasses that makes us see the world in a specific way. But the truth is that we are largely responsible for how we feel and act, but it does not mean that another person, situation, or event sometimes causes your behavior. However, understanding this emotional responsibility is very important to change how we feel. Our feelings and reactions are greatly influenced by the attitudes and beliefs that we currently hold as true. Some of those beliefs may be untrue and unhelpful to us, but we are no longer question them. CBT helps to become more aware of how our thought patterns create our reality and influence how we feel and behave. It helps us to change our unhelpful interpretations in order to change our feelings and behavior. Often part of our thoughts are more in the background than we have them loud and clear in our head. This can be very problematic for us if our thoughts, feelings, and behaviors are particularly negative or destructive. So let me give you an example of a negative self-talk pattern of somebody with low self-esteem. A friend didn't contact this person for a while, and he has jumped to the conclusion that his friend doesn't care about him anymore. As a result, he was feeling sad and insecure. He was thinking, I'm worthless, and he was avoiding to face this friend instead of taking the initiative and contacting him. So you can see how a thought contributes to the feelings, contributes to the behavior, and it goes around and around. But there are other possibilities he has not thought about. Perhaps the friend has not known how to respond or did not want to disturb him with a call, or maybe have been very busy, ill, or out of town. When you often repeat negative thoughts in your head, they become natural and you automatically start to think them. As a result, you are no longer aware that you have those thoughts. You don't notice the feelings and emotions that go with it. These thoughts we also call negative automatic thoughts. Within CBT, we look for those thoughts. One tool in CBT which is helpful in understanding and changing this process is the cognitive triangle. The cognitive triangle is simply a diagram that shows how our thoughts, emotions, and behaviors are all interconnected with each other and influence one another. Therefore, you can change or at least influence one by changing another. It doesn't matter which one you start with. For example, you can influence the way you feel about something by changing behaviors or by changing your thoughts. But the easiest and it makes the most sense for you to start with changing your thoughts. When you recognize the thoughts, you can then investigate to what extent they are actually correct. When you actually have no proof that your thoughts are correct, you can come to the conclusion that you can see them in a different way. But it's not enough to understand a negative thought. Understanding does not create emotional change. If you were to read a book on how to drive a motorbike, understanding that does not transform you into a competent driver immediately. You would have to apply what you understand, like getting on the motorbike, accepting it feel uncomfortable and challenging at first, and mistakes can be made. But as more you practice and are persistent, you will begin to feel comfortable and in control of the vehicle. So it's also important to replace your negative thoughts with more real, helpful thoughts. This will affect how you feel and finally what you do or how you react in a situation. You cannot always control the situation itself, but you can manage it. During CBT, you will learn a number of techniques to investigate whether your thoughts are correct in a certain situation. If necessary, you formulate new thoughts that are better suited to the situation. We call this more realistic thoughts. These new thoughts will make you feel different. The last step is behavior change. During CBT, you can learn and practice new behaviors in order to apply them in your daily life. CBT can be provided on one-to-one basis or as part of group therapy. Typically, you would see a therapist once a week or once every 2 weeks. A therapy usually takes between 5 to 20 sessions, with each session lasting about 45 minutes. CBT is a very active form of therapy, so you may be expected to take a proactive role. People never come to therapy just to feel good for the hour. They come to improve their lives out in the real world. For this reason, therapists would encourage you to apply new skills between sessions and report back on how it went. Homework assignments are an essential part of CBT. Your therapist will ask you to monitor your automatic thoughts with corresponding feelings and behaviors in different situations. Besides, you will learn skills that will help you with your current problems and that you can apply to future problems. You will learn to think and act in accordance with your healthy beliefs, even though it will feel uncomfortable at first. The process of change requires repetition and consistency. CBT sessions tend to be very straightforward and down to earth. So probably you and your therapist will discuss things in a very open way and talk about what might make things better for you. During a usual CBT session, two of you are working together and trying things out so you find some good ideas that work well. Research shows that CBT has helped children and adults with many different mental and physical conditions, like anxiety issues, panic and phobias, obsessive-compulsive disorder, post-traumatic stress disorder, depression, eating disorders, relationship issues, anger and stress, insomnia, low self-esteem, grief, substance abuse, and addiction. Engaging with CBT can help people reduce stress and face many other common life challenges. It usually results in improvements that the therapist will begin to measure with outcome measurement tools, like, for example, questionnaires or scales. In summary, CBT is a widely used and successful approach. Even though improvement with CBT is gradual and takes patience, the long-term results can be dramatic. If you liked this video, please give me a thumbs up. It motivates me to keep making more content for you. But also share with your friends and don't forget to subscribe and turn on the notification bell. See you next time.